How does someone know that they've sustained a concussion?
So there are multiple factors that go into sustaining a concussion. There's actually two main factors. It can either be a direct blow to the head or it can be a rotational force. So a lot of times when we have athletes that sustain a concussion, the direct blow comes from a hit, say a football player or a soccer player hitting their head on the ground or impacting with another player during an athletic event. The rotational force sometimes can come from a swimmer turning too fast underwater, a gymnast flipping too quickly through the air and not having good head control, or a hockey player being whipped around on the ice by an unsuspected player hitting them on the backside.
So that's interesting for me, because for me it makes sense if somebody's head hits the floor or hits something hard, but you're saying something like a twist, a quick twist.
It could be a quick twist. A lot of times we get concussion patients who have sustained a concussion from a whiplash injury, such as in a motor vehicle accident. Their head never hit the steering wheel, it never hit the dashboard, but what had happened was they had what's called a coup, counter-coup event. So the coup would be the brain moving forward in the skull, and the counter-coup would be the retraction force of the brain hitting the back of the skull, and then a re-coup hitting the front again. So the brain sits inside the skull without any attachments. It's kind of like a jello mold that sits in there. And when that glass bowl that's holding that jello mold gets shaken around, that jello mold is going to hit all the sides of the glass bowl and sustain injury wherever the head is possibly
so that means your
hit.
brain is basically bouncing off the skull then on the inside.
Yes.
Wow. And so the twist so anyone twisting, I find that really interesting.
Yes. Anybody twisting, figure skaters, gymnasts, hockey players, swimmers.